Great. Hi guys. I hope all of you guys are keeping well. And our today's topic is going to be anti-tubercular drug according to NTEP 2020. NTEP is National Tuberculosis Elimination Program. I got multiple requests from the students. Sir, TB में अलग-अलग जगह पे अलग-अलग चीजें दी गई हैं. Please help us understand and please give us the exact guideline and a way through which we can actually remember the anti-tubercular drug. So rest assured, the next 25 to 30 minutes is going to be the most learning minutes for all of you guys, where we'll not only summarize anti-tubercular drug, the program of NTEP, but also we'll make sure that we are going to utilize different mnemonics and story to remember most of the important points about TB. So TB में इसके बाद से you don't have to look anywhere else. After this one, you don't have to look anywhere. That is my assurance. And at the end of the session, I am having few important MCQs for all of you guys that has been asked in the 2022-2023 examination, different examination like NEET-PG, INI-CET, okay, and also in FMGE. Let's see in NTEP, according to NTEP, anti-tubercular drug that we are having. Remember, lot of changes that has been done. The majority of changes that we know, it is mainly majority of changes that is known according to NTEP is mainly for drug resistant TB. Drug resistant TB. NTEP, I think I have already told to all of you guys that NTEP is going to be your National Tuberculosis Elimination Program. National Tuberculosis Elimination Program. Before this, the program was known as your RNTCP, Revised National TB Control Program, that we are not following. We are following this one. Now, according to this one, we are going to see two type of patient. One is known as your drug sensitive tuberculosis, and other one is known as your drug resistant tuberculosis. Drug sensitive and drug resistant TB. Now, what is drug sensitive tuberculosis? The meaning itself, the name itself is saying its meaning. That means it is sensitive to standard first line drug. That means drug sensitive tuberculosis की अगर बात करेंगे, so drug sensitive tuberculosis में they are going to be sensitive to, this drug is actually sensitive to standard first line drug that is known as your isoniazid and rifampicin. There is no changes in a drug sensitive tuberculosis. It was as it was in RNTCP in the same way. Right now it is also in the same way. In the drug sensitive tuberculosis, the duration of therapy that we are going to give is going to be for 6 months. Again, it's going to be having same. There is no change at all. In this 6 month, remember, we are going to utilize this 6 month into two important phases. One will be known as your intensive phase, that will be given for 2 months. So first we are going to give for 2 months. पहले 2 महीने के लिए देंगे. Sometimes students get confused in the examination and पहले 4 महीना फिर 2 महीना, फिर somehow they get confused. ना? They do a lot of calculation. All right. So intensive phase first 2 months, and then we are having continuation phase, which we are going to give it for 4 months. Right, 4 months. So in the intensive phase, what all drugs that we have in the intensive phase is going to be the same drug that we know, that is isoniazid, rifampicin, pyrazinamide and ethambutol. We call simply as HRZD, isoniazid, rifampicin, pyrazinamide and ethambutol. Now only for today, I would like all of you guys, and I would request all of you guys to remember pyrazinamide as pyrazinamide. There is definite reason behind that I'll be telling you subsequently. Isoniazid, rifampicin, pyrazinamide and ethambutol. And in the continuation phase, we are going to continue with HRE. So if the examiner is going to ask you on the basis of number of drugs, I think it's pretty simple for all of you guys that there will be 4 drugs in the intensive phase, and there is going to be 3 drugs in the continuation phase that is given for the 4 month. Now we are going to focus more towards the drug resistant TB, because that is what the changes is lying here in the NTEP 2020. And drug resistant TB, we have MDR TB, where the resistance is going to be seen with the standard first line drug, that is going to be isoniazid and rifampicin. If there is going to be resistance with the isoniazid rifampicin, we call it as a MDR TB, multi drug resistant TB. However, sometime we will see that there is going to be resistance only with the rifampicin. They will be classified under MDR only, but we call them as a rifampicin resistant TB, RRTB, rifampicin resistant TB. The treatment remains the same here. It's just that in drug resistant TB, or I would say rifampicin resistant TB, isoniazid will be given in the higher dose. Okay. Now we have XDR TB. According to recent guidelines, the definition that we have for XDR TB is extensive drug resistant TB. Remember, in one of the examinations they gave the term extremely drug. There is no such thing like extremely, it's called extensive drug resistant TB. There is going to be resistance with, in XDR TB there will be resistance actually with the isoniazid and rifampicin. तो चलता रहेगा. isoniazid rifampicin. Apart from that, there will be any one fluoroquinolone. It could be moxifloxacin, it could be any one fluoroquinolone. Remember that, okay? And either there will be resistance with the bedaquiline, BDQ is bedaquiline, or either bedaquiline, or there will be resistance with the linezolid. And bedaquiline is one of the newer anti-tubercular drug, that is one of the ATP synthase inhibitor, and linezolid is usually it's a protein synthase inhibitor that is acting in the 50S ribosomal unit. Now if you are one of the students those who are following the older definition of the XDR-TB, this is the older definition I have given you just for your reference. That older definition that we used to say for XDR-TB is going to be resistance with the isoniazid rifampicin. Okay, agreed. Apart from that, any one fluoroquinolone, ये दोनों तो same है, but पहले क्या था कि there should be one second line injectable. Remember, in the NTEP 2020 there is no injectable, है ना? So the concept of injectable has been removed. Injectables are only, remember, injectables are only used as a reserved drug, है ना? वो सिर्फ reserved drug के form use करते हैं. तो this is the newer guidelines, है ना? Newer guidelines आपके सामने है. Isoniazid rifampicin, one fluoroquinolone, and either bedaquiline or linezolid. Either bedaquiline or linezolid. This is the definition. पहले तो हम बात करेंगे definition की. Now NTEP में जो National TB Elimination Program है, what are the changes? Let me just summarize once again to all of you guys. As I was telling to all of you guys that compared to RNTCP, where the therapy was for 2 years, that was extended to 2.5, and in some cases it was given also for 3 years in XDR-TB, है ना? Now they are telling we should decrease the duration of therapy. The number of drugs should also be reduced. Earlier there were 7 to 8 drugs. Now the number of drugs for XDR-TB is markedly reduced. 4 drugs, 3 drugs, like that. Huh? There should be no injectables, and they are also promoting oral drugs. Promote oral drugs. Now because of all these, that we are doing, we are expecting that the compliance should be improved, and there has been report that yes, compliance has been improved. Imagine, no, the patient has to take one injectable on the daily basis for 6 months, and in some cases could be extended up to 12 months as well, है ना? तो 6 से 12 महीने के लिए डेली एक अमाइनो ग्लाइकोसाइड का इंजेक्शन लेना है ना? तो होता क्या था, compliance was very poor because of that. Now all oral drug, NTEP में पहले condition में we should all promote oral drug. At any point of time, if oral drug is not available or the patient is non-responsive to that, then we can take a drug from our reserve category. We call it as a group C, that I'll be telling you subsequently. Remember, drug resistant TB के लिए according to NTEP 2020, National TB Elimination Program 2020, we have two important regimen, shorter regimen and longer regimen. In the shorter regimen, what do we have? In the shorter regimen, there are two shorter regimen basically. There are two shorter regimen. One is for 6 to 9 months. One is for 6 to 9 months, and another one is for 9 to 11 months. 6 to 9 months and 9 to 11 months. This 6 to 9 month wala that we have, this is known as your B-Pol regimen. This is known as what? B-Pol regimen. B-Pol regimen. What is this B-Pol regimen stand for? B-Pol regimen stand for your B for bedaquiline. B for bedaquiline. Remember guys, B for bedaquiline, it is one of the ATP synthase inhibitor. It is one of the ATP synthase inhibitor. It is cidal in nature. Very recent question that was asked in the recent examination, that they are associated with side effect called QT prolongation. Plus they are also highly hepatotoxic, and they are also associated with the electrolyte imbalance. And that is another side effect. Okay? Now apart from that, B-Pol regimen में और क्या ड्रग आता है? P stand for your pretomanid. P stand for what? Pretomanid. Now pretomanid is the younger brother of delamanid. No? So we have manid and manid. Pretomanid. No? So what is this manid? Manid and manid, they are actually your mycolic acid synthesis inhibitor. They are actually mycolic acid synthesis inhibitor. Remember, the Mycobacterium cell wall is made of mycolic acid, and because of this reason, they are highly cidal agent as well. Their side effect is pretty much similar to bedaquiline. है ना? जैसे QT prolongation, hepatotoxicity, similar kind of side effect is also seen with the pretomanid as well. And next that we are having is known as your linezolid. Linezolid, that is your B-Pol regimen. Linezolid is one of the protein synthase inhibitor. This B-Pol regimen that I have written here, please do remember that this B-Pol regimen, it is mainly utilized for IPD patients. IPD means inpatients, those who are having XDR-TB. XDR-TB, or those who are non-responsive to longer regimen. I am repeating again. If you are taking note, please take note. IPD patient मतलब inpatient जो admit है and you are going to give under your own supervision. Why? We are having two very important drug here. One is called your bedaquiline and other one is called pretomanid. They both are associated with the QT prolongation as a very important side effect. So you should be very careful. You should always keep an eye on the LFT. You should always keep an eye on the ECG. ठीक है? Now 9 to 11 month वाला is the one that we are going to utilize for our all the OPD patient. है ना, MDR TB के लिए MDR TB पेशेंट जितने भी OPD पेशेंट है, we are going to utilize 9 to 11 month वाला. Now please remember that when you read the PDF of the NTEP 2020 वाला, they have given a very longer PDF. I have tried to simplify it down for all of you guys. This 9 to 11 month वाला that I'm telling you, I fondly call it, they have not mentioned this term, but I fondly call it as a Bay-Clep regimen. Bay-Clep regimen. Please remember, Bay-Clep regimen is not some some regimen. I simply call it as so that you can easily remember. ये मैंने खुद आपको दिया है so that आप इसको याद कर सकें आसानी से. Bay-Clep regimen. Now why do I call it as a Bay-Clep regimen? There is a definite reason behind this one, है ना. Definite reason क्या वो हम देखते हैं. Longer regimen जो है वो 18 महीने का है, 18 month का. That I will discuss in my upcoming slides. ठीक है. नाउ Bay-Clep रेजिमेन जो कि हमारे ओपीडी पेशेंट के लिए, वो सबसे पहले देखते हैं. पीपॉल रेजिमेन, आई थिंक ऑल ऑफ यू गाइस आर ओके हियर. पीपॉल रेजिमेन आईपीडी पेशेंट के लिए, पीपॉल रेजिमेन बेटाक्विलिन, प्रिटोमेनिड, लिनेजोलिड, है ना. लिनेजोलिड का इंपॉर्टेंट साइड इफेक्ट अगर एग्जाम में पूछ ले तो क्या बताओगे? लेट मी जस्ट राइट इट डाउन. इंपॉर्टेंट साइड इफेक्ट्स, क्योंकि मैं इंपॉर्टेंट पॉइंट्स मिस नहीं करना चाह रहा. They are associated with important side effect called bone marrow suppression, and in the bone marrow suppression also preferably, or I would say most commonly, there will be decrease in the platelet count. So after starting linezolid, if there is decrease in the platelet count, it's most likely due to your linezolid mediated bone marrow suppression. It can also be associated with peripheral neuropathy, and they can also be associated with a common side effect called सेरोटोनिन सिंड्रोम. यू सी सेरोटोनिन सिंड्रोम मैं बार बार आपको पढ़ाता हूँ माओ इनहिबिटर में. सेरोटोनिन सिंड्रोम व्हेन आई विल डिस्कस यूजुअली विद योर पार्किंसन डिजीज, वहां पे बात करते हैं सेरोटोनिन सिंड्रोम की. एसएसआरआई में बात करते हैं सेरोटोनिन सिंड्रोम की. बट वी आर डिस्कसिंग सेरोटोनिन सिंड्रोम इन एंटीमाइक्रोबियल. सो दिस विल बी अ वेरी पोटेंशियल एमसीक्यू. व्हिच एंटीमाइक्रोबियल कैन कॉज सेरोटोनिन सिंड्रोम? हियर यू हैव योर आंसर. द नेम ऑफ द कंपाउंड इज linezolid for all of you guys. All right, now let me quickly go ahead and brief all of you guys about the Bay-Clep regimen. As I told you that there is no such regimen called Bay-Clep regimen. वो simplified mnemonic है, मैं उसको Bay-Clep बोल रहा हूँ. आप बोल मत दीजिएगा कहीं वाइवा में सर Bay-Clep regimen, है ना. एग्जामिनर व्हाट लगा देगा है ना. Bay-Clep regimen बस mnemonic है. ठीक है. 9 to 11 month के लिए है ना. 9 to 11 month में होता क्या है? Intensive phase that is given for 4 to 6 month, and then we are having continuation phase that is given for the 5 month. Now Bay-Clep का जो मीनिंग है वो यही आपको समझ में आ जाएगा. The drugs in the intensive phase is going to be BEI Bay, और बे के साथ करना है क्लेप या क्लब. बे के साथ करना है क्लेप या क्लब. बे के साथ क्लब, है ना. नाउ देखिए सभी के पास आजकल के टाइम में बे होते हैं ना. बेब्स, आप बेब्स को बे बोलते हैं ना. जो आप सोशल मीडिया के एडिक्ट हैं, आप सभी को पता है, मैं भी एडिक्ट हूं, है ना. और हम यूजुअली, मैं तो नहीं बोलता हूं, बट हाँ आई एम प्रीटी श्योर दैट आप सभी की अपनी अपनी बे होती होंगी. बेब्स, बेबी को बोलते हैं ना, बेब्स को BAE. तो हमारे फार्मा में हम लोग वो BAE नहीं बोलते हैं. बेब्स लाइक दिस, बे लाइक दिस, बे लाइक दैट. वी फार्माकोलॉजिस्ट वी कॉल इट एज अ बे, BEI. बे के साथ करना है क्लेप. नो बे के साथ करना है क्लेप. व्हाट आर द ड्रग्स दैट इज कमिंग अंडर बे के साथ क्लेप? लेट मी क्विकली समराइज फॉर ऑल ऑफ यू गाइस. बी स्टैंड फॉर योर बेटाक्विलिन, E stand for your ethionamide, bedaquiline, ethionamide, isoniazid. Please remember, isoniazid we are going to utilize in high dose. High dose isoniazid have shown to be effective in RR-TB and even in drug resistant TB as well. CLEP stand for your clofazimine, levofloxacin, ethambutol, एंड पी स्टैंड फॉर वही अपना प्यारा प्यारजिनामाइड, है ना. मैं क्या लिख दिया? पायराजिनामाइड. आई होप मैं प्यार ना लिख दूं, है ना. पायराजिनामाइड. सो दिस इज गोइंग टू बी योर बेक्लेप रेजिमेन, BEICLEP, राइट। नाउ बेक्लेप से आपको याद ये रखना है कि एक ऐसी बेब्स जिसका नाम का स्पेलिंग ही गलत है, एक ऐसी बेब्स जिसके नाम के स्पेलिंग में ही कुछ एबनॉर्मेलिटी है, I would not like to continue with such bay. ऐसी babes के साथ I would not like to continue. So this bay that we are having, bay here will not be utilized in the continuation phase. And वैसे भी बेटाक्विलिन जो ड्रग होता है ना, बियॉन्ड 6 मंथ इसको देते नहीं है, बिकॉज रिमेंबर पोटेंशियल कार्डियोटॉक्सिक एजेंट, वेरी वेरी कार्डियोटॉक्सिक एजेंट। तो हाउ वी आर गोइंग टू कंटिन्यू इन द कंटिन्यूएशन फेज फॉर द नेक्स्ट 5 month, we are going to utilize only with the CLEP. So if the examiner is going to ask you on the basis of number of drug which has been asked in one of the 2019 जब RNTCP चल रहा था तब पूछा था number of drugs पे, this time if they are going to change the question, remember BECLEP, तो आपको आसानी से सब याद हो गया ना, BECLEP number of drugs भी याद होगा, BEICLEP, तो total number of drugs in the BECLEP is going to be 7 drugs in the intensive phase। और किसके साथ कंटिन्यू नहीं करना है, बेब्स के साथ कंटिन्यू नहीं करना है ना, तो कहां जाना है, सिर्फ और सिर्फ क्लेप। सो क्लेप में हाउ मेनी ड्रग्स आर देयर, ओनली CLEP है ना, तो 4 ड्रग्स, so 7 and 4 drugs। I think it's pretty simple that each one of you can easily remember। एक बार फिर से रिपीट करता हूं, we are having shorter regimen, we are having longer regimen। shorter regimen में we are having 2 shorter regimen, 6 to 9 month वाला, 9 to 11। 6 to 9 month IPD patient for the XDR-TB, for all the OPD drug resistant patient we are having 9 to 11 month, और मैं उसको फॉन्डली क्या बोलता हूं, as a mnemonic, BECLEP regimen, BEICLEP, 7 drugs in the intensive phase। for the next 5 months we are going to utilize only CLEP। CLEP will be क्लोफेजिमिन, लीवोफ्लॉक्सिन, ethambutol and pyrazinamide, which I fondly call it as a pyrazinamide। Now ये जो ड्रग ग्रुपिंग था that is utilized mainly in the longer regimen, है ना। ड्रग ग्रुपिंग कैसे किया गया, ग्रुप ए ड्रग, अंडर ग्रुप ए we are having levofloxacin, linezolid and bedaquiline। अंडर ग्रुप ए levofloxacin और moxifloxacin, है ना। अगर levofloxacin से रेजिस्टेंस है तो you can use moxifloxacin। So levo, moxifloxacin, they are the fluoroquinolone which is one of the DNA gyrase inhibitor, DNA gyrase inhibitor। linezolid again the same protein synthase inhibitor, and bedaquiline the same, that is ATP synthase inhibitor। under group B we are having 2 drugs that is starting with CC। तो A वाले हो गए, A वाले कैसे याद किया आपने, LLB, वेरी सिंपल नेमोनिक नो, LLB। मैंने इसको सिंप्लीफाई किया हुआ आपके लिए, बस इतना सिंप्लीफाइड वर्जन आपके PDF में नहीं होगा, है ना। तो जस्ट रिमेंबर ये सिंप्लीफाइड वर्जन, सो यू कैन रिमेंबर, है ना। CC here is going to be cycloserine और क्लोफेजिमिन, आइदर ऑफ देम। फ्रॉम ग्रुप बी वी टेक एनी वन, कोई भी एक लेते हैं ग्रुप बी से, है ना। साइक्लोसेरिन, टेरिजिडोन, है ना, और एक और है हमारा क्लोफेजिमिन। तो सीसी में बोलता हूं, याद करिए, 2 याद करिए, साइक्लोसेरिन, क्लोफेजिमिन। आउट ऑफ दीज 2 एनी वन विल बी टेकन। देन वी आर हैविंग ग्रुप सी। ग्रुप सी में वी हैव मेनी अदर ड्रग्स लाइक pyrazinamide, paraminosalicylic acid, ethambutol, ethionamide, delaminate, and to your surprise your aminoglycoside injectables are also given again, and your imipenem, carbapenem, you know, carbapenem group ka imipenem, meropenem is also given। they are also, you know, they are all injectable agent, they are all a reserved drug in a non-responsive cases, or if the person is allergic to any of the group A, group B drug, then we can replace any of the group C drug, है ना। if agent from group A or B cannot be used, or group C drug is added to complete the regimen, है ना। now longer regimen की तरफ चलते हैं। what are the longer regimen that we are having? under longer regimen that we are giving actually for 18 month, longer regimen which we are giving actually for 18 month, remember we have to again divide this 18 month into 2 important, that is intensive phase given for 6 month, and continuation phase that we have, it is given for 12 month। तो 12 और 6 कितना होगा, 18, 12 और 16 हो गए, 12 और 6 हो गए 18। so we are going to give ग्रुप ए वाले जो ड्रग हैं होंगे ग्रुप ए। तो ग्रुप ए वाले ड्रग मेरे साथ रिपीट कर दिए। व्हाट वाज द ग्रुप ए ड्रग दैट वी हैव, आई टोल्ड यू LLB। LLB वाले कौन से थे, LLB वाले कौन से थे आप बताइए। LLB वाले था लिनेजोलिड, लीवोफ्लॉक्सासिन और B फॉर बेटाक्विलिन। और फिर हमारे पास था ग्रुप सी, सॉरी ग्रुप बी वाला ड्रग था, ग्रुप बी वाले में क्या था, CC स्टैंड फॉर योर साइक्लोसेरिन। मेरे साथ प्लीज रिपीट करते रहिए, साइक्लोसेरिन। एंड वी आर ऑल्सो हैविंग CFZ दैट इज क्लोफेजिमिन। और ग्रुप बी में से मैंने रूल क्या बताया था कि यू आर गोइंग टू टेक एनी वन। ग्रुप सी इज ऑलवेज, रिमेंबर गाइस, इट्स अ रिजर्व ड्रग, है ना। तो अगर मैं पूछूं कितने नंबर ऑफ ड्रग्स आप ले रहे हैं इन द इंटेंसिव फेज, तो LLB तो लेना ही है तीनों, लिनेजोलिड, लीवोफ्लॉक्सिन और मॉक्सीफ्लॉक्सासिन, दोनों में से कोई, और बेटाक्विलिन। तो मैं आसान करने के लिए LLB के साथ चल रहा हूं। सो वी आर हैविंग LLB 3 यहां हो गए, और ग्रुप बी में से एनी वन, साइक्लोसेरिन, क्लोफेजिमिन, दोनों में से कोई एक। तो कितने ड्रग हो गए, 4 ड्रग्स इन द इंटेंसिव फेज। आप देख रहे हैं कितना वेरिएशन हो रहा है। अर्लियर 7-8 ड्रग थे RNTCP में, अब सिर्फ 4 ड्रग हो गए। कितने दिन के लिए? टोटल ओवरऑल 18 मंथ की बात हो रहा है, जिसमें इंटेंसिव फेज इज लास्टिंग ओनली फॉर 6 मंथ, नो इंजेक्टेबल एट ऑल, है ना। एंड व्हाट वी आर गोइंग टू डू इन द कंटिन्यूएशन फेज इज, अगर मैं आपसे सिंपली पूछूं बच्चे एक ड्रग का नाम बताओ जो कार्डियोटॉक्सिक है और 6 महीने से ज्यादा नहीं देना है, जो अभी थोड़ी देर पहले बताया था आपको, आसानी से आप बोल पाओगे सर अभी तो आपने बताया था कि लिनेजोलिड होगा, लीवोफ्लोक्सिन हम यूज करेंगे, बेटाक्विलिन वी आर नॉट गोइंग टू यूटिलाइज बिकॉज बेटाक्विलिन अगेन is a cardiotoxic drug, so we will not be continuing with the bedaquiline. We will not be continuing with the bedaquiline, so we are going to utilize either cycloserine or clofazimine. तो अगर मैं पूछूं बताइए number of drugs, so number of drugs in the continuation phase will be how many number of drugs? So 3 drugs. So 4 drugs in the intensive phase, 4 drugs in the intensive phase, 3 drugs in the continuation phase. आसानी से सारी बातें याद हो गई। अगर नंबर ऑफ ड्रग्स पे देखना है तो देखिए मैं यहाँ पे समरी लिख भी चुका हूँ आराम से आपके लिए। ड्रग सेंसिटिव ट्यूबरकुलोसिस में 4 ड्रग्स इन द इंटेंसिव फेज फॉर 2 मंथ एंड 3 ड्रग्स इन द कंटिन्यूएशन फेज फॉर 4 मंथ। ये पहला हो गया ड्रग सेंसिटिव ट्यूबरकुलोसिस का। 9 to 11 मंथ वाला जो है आपका 7 ड्रग्स इन IP फॉर 4 to 6 मंथ एंड फॉर द 5 मंथ वी आर हैविंग कंटिन्यूएशन फेज 4 ड्रग्स, है ना। क्लैप वाला बे क्लैप वाला है ये, है ना, बे क्लैप वाला है। आसानी से याद रहेगा, कभी नहीं भूलेगा। मैंने प्रॉमिस किया था कभी नहीं भूलोगे तो भूलोगे भी नहीं। 18 मंथ वाला अगेन 6 मंथ प्लस 12 मंथ, 4 ड्रग्स इन द कंटिन्यूएशन, 4 ड्रग्स इन द इंटेंसिव फेज एंड 3 ड्रग्स इन द कंटिन्यूएशन फेज। 4 ड्रग कौन सा? LLB, लिनेजोलिड, लीवोफ्लोक्सिन, बेटाक्विलिन और आइदर साइक्लोसिन, क्लोफाजिमिन, दोनों में से कोई है। 4 ड्रग्स हो गए एंड कंटिन्यूएशन फेज में हम देंगे 3 drugs, linezolid, levofloxacin, and we are going to utilize either cycloserine or clofazimine. Bedaquiline will not be utilized, है ना। Now, what are the condition where are we going to choose longer regimen या longer therapy? Remember, अगर कोई patient है जो who has taken more than 4 week of second line anti-tubercular drug and stop, पहले इसको एक word use करते थे ना, आप सब जानते भी होंगे, defaulter. Defaulter is anyone who has taken a second line compound for more than 4 weeks and stopped. उसमें हम देंगे longer regimen. If there is resistance to one fluoroquinolone, then we can change it to other fluoroquinolone. In pregnancy and also in a pediatric, pregnancy and pediatric less than 6 year में हम यही देंगे. If there is extensive tuberculosis, है ना, extensive pulmonary tuberculosis with let's say bilateral cavitation, है ना, or extensive lung parenchymal involved, or if there is a severe extrapulmonary TB. Let me summarize and revise once again. कहाँ पे longer regimen यूज करेंगे? सबसे पहले याद करिएगा, सबसे पहले मैं बोला था कि longer regimen will be utilized if there is someone who has taken second line drug for more than 4 weeks and stop. That means 1 महीने से ज्यादा लेकर के बंद कर दिया, तो usually defaulter वाले कंडीशन में longer regimen. Kids that is less than 6 year and pregnancy longer regimen. इतना क्लियर हो गया। Severe pulmonary TB, again severe extrapulmonary TB में भी also we can utilize longer regimen. Severe extrapulmonary TB also longer regimen. But usually अगर पूछता है कि drug sensitive CNS tuberculosis है ना, then in that case scenario the therapy will change a bit, है ना। तो duration को थोड़ा बढ़ा के हम 9 month के लिए देते हैं, rather than giving for 6 month we give it for the 9 month, है ना। This is one table that has been given in almost all pharma textbook, and I want to summarize this table for all of you guys, and we make sure that we'll definitely have question on this one. तो first line के जितने भी ड्रग हैं एक जगह summarize कर लेते हैं। Isoniazid, rifampicin, pyrazinamide, ethambutol and streptomycin. ethambutol and last वाला जो है वो है streptomycin, HRZES. ब्रैकेट में इसका दिया हुआ है डोज, and dose should be mg per kg. mg per kg dose. So let us summarize what is the dose mg per kg. Isoniazid will be given in a dose of 5 mg per kg. Rifampicin will be given in a dose of 10 mg per kg. Pyrazinamide, प्यार, ये अब यहाँ से प्यार वाली कहानी शुरू हो रही है। प्यार का डोज विल बी गिवन 25। आप ध्यान रखिएगा, कई बार बच्चे एग्जाम में भूलते हैं कि HRZE, HREZ, वो कंफ्यूज रहते हैं, किसका ज्यादा था किसका कम था, वो कुछ ना कुछ सोचते रहते हैं और खिचड़ी करके आ जाते हैं एग्जाम में, है ना। तो मैं आपको बोल रहा हूं कि प्यार का डोज लाइफ में हमेशा हाई रखिएगा, ये पहला पॉइंट है। क्यों मैं आपको बोल रहा हूँ पायराजिनामाइड को प्यारजिनामाइड, कुछ भी हो जाए देखिए आइसोनाइजिड रिफाम्पिसिन जहां 5 और 10 दे रहे थे, प्यारजिनामाइड को सीधे 25 दे रहे हैं ना। तो प्यार का डोज लाइफ में हमेशा हाई। इथम्बुटोल, स्ट्रेप्टोमाइसिन 15 mg, 10 to 15 mg पर kg के हिसाब से वी यूजुअली कीप। If I'm going to ask to all of you guys what is the mechanism of action, first and foremost I'll be discussing about isoniazid. Remember guys, isoniazid, INH, I have written here isoniazid. This isoniazid INH, it's one of the compound that is usually in the inactive form. This isoniazid which is in the inactive form, it gets activated with the help of an enzyme called catalase peroxidase. It gets activated with the help of an enzyme called catalase peroxidase. catalase peroxidase, it causes activation of isoniazid. The INH isoniazid will become active. This active form of isoniazid, remember guys, they are actually going to do mycolic acid synthesis inhibition. दे आर द माइकोलिक एसिड सिंथेसिस इनहिबिटर. अब सोच के बताइएगा बच्चे, अगर ये माइकोलिक एसिड सिंथेसिस को इनहिबिट करेगा तो विल इट बी कॉजिंग स्टैटिक प्रॉपर्टी और साइडल प्रॉपर्टी. माइकोलिक एसिड इज द मेजर कॉन्स्टिट्यूएंट ऑफ द माइकोबैक्टीरियम सेल वॉल, सो डेफिनेटली दे विल हैव साइडल प्रॉपर्टी. अब यहाँ पे एक थोड़ा सा ट्विस्ट डालूंगा मैं. ट्विस्ट ये है कि दिस कैटालेस पेरोक्सिडेज एज एन एंजाइम, हाउ इंपॉर्टेंट इज दिस एंजाइम फॉर द फंक्शन ऑफ दिस ड्रग. आप बताइएगा कितना इंपॉर्टेंट है ये. आप बोलोगे सर यही तो सबसे ज्यादा इंपॉर्टेंट है, बिकॉज कैटालेस पेरोक्सिडेज के वजह से ही दिस ड्रग इज गेटिंग एक्टिवेटेड. अगर कैटालेस पेरोक्सिडेज काम नहीं करेगा तो दिस ड्रग विल नॉट बी एक्टिवेटेड, एज सिंपल एज दैट. ओके, सो इफ कैटालेस पेरोक्सिडेज इज एबनॉर्मल द ड्रग विल नॉट फंक्शन नॉर्मली, राइट. एंड कैटालेस पेरोक्सिडेज, इट्स वन ऑफ द एंजाइम दैट इज एनकोडेड बाय अ जीन कॉल्ड cat G gene, Katrina G wala gene. So this cat G gene encodes an enzyme called catalase peroxidase. Cat G gene is an enzyme, it's a gene that encodes enzyme catalase peroxidase, and this catalase peroxidase normally causes activation of the isoniazid. And here a simple MCQ, which of the following gene resistance will be leading to which of the following gene mutation will be leading to resistance of the isoniazid. कौन से जीन म्यूटेशन की वजह से आइसोनाइजिड में रेजिस्टेंस आ जाएगा? तो आंसर आपके सामने रखा हुआ है, आराम से सर्व करके रखा हुआ है. कैट जी जीन म्यूटेशन अगर हो गया तो आइसोनाइजिड विल नॉट बी इफेक्टिव. रिमेंबर, दिस इज अ ड्रग दैट विल बी हैविंग साइडल प्रॉपर्टी. इट इज वन ऑफ द साइडल ड्रग. Rifampicin, R for rifampicin, it's one of the RNA polymerase inhibitor. That RNA is dependent on the DNA, so completely we call it as a DNA dependent RNA polymerase inhibitor. In simple term also, you just remember R for rifampicin, R for RNA polymerase inhibitor, and they are also having sidal property. Rifampicin is also having sidal property. Apart from that, remember Z is pyrazinamide, pyrazinamide. Now pyrazinamide काम कैसे करता है, पहले उस पर बात करेंगे. दिस pyrazinamide एज अ कंपाउंड, ये ऐसा नहीं कि कहीं पे भी जाके काम करेगा, नहीं. इट विल एंटर द सेल फर्स्ट. ये जो Z है, Z फॉर pyrazinamide, it will enter the bacteria and inside the cell they will get activated. They are getting activated with the help of an enzyme called pyrazinamidase. ध्यान रखिएगा, एंजाइम का नाम क्या है? Pyrazinamidase is the name of the enzyme that is causing activation of, it is this enzyme that is causing activation of pyrazinamide. And this active pyrazinamide, actually this active pyrazinamide, it is going to cause mycolic acid synthesis inhibition. It is going to cause mycolic acid ka synthesis inhibition. This will be inhibiting your mycolic acid synthesis, right? If they are going to inhibit mycolic acid, remember they are definitely having sidal property, they are also sidal. So why am I discussing this? Because pyrazinamide is one of the compound that is going and it is actually working from inside. ये अंदर जाके ही काम करेगा. It's one drug that is working exclusively intracellular, for the exclusive intracellular bacilli. E for ethambutol. ethambutol, इसको कैसे याद करोगे? देखिए, ethambutol, थम जाना मतलब होता है रुक जाना. थम जाना इज रुक जाना. ethambutol, थम जाना इज रुक जाना. दिस इज वन ऑफ द arabinosyl transferase inhibitor. arabinosyl transferase inhibitor. Now होता क्या है arabinosyl transferase को इनहिबिट करके? There will be arabinosyl transferase inhibitor. If there is arabinosyl transferase inhibition, there will be no polymerization of arabinoglycans. अब आप पूछोगे सर what is this arabinoglycans? ये arabinoglycans है क्या? What is this arabinoglycan? So this arabinoglycan is also one of the essential constituent of the cell wall. It is also one of the constituent of the mycobacterium cell wall. ये भी mycobacterium के cell wall का एक constituent है, but not as important constituent as the mycolic acid, है ना. So this ethambutol, मैं थम इसलिए लिखा हूं because ये थम जाता है, ये ग्रोथ को रोक देता है. थम जाना मतलब रुक जाना, थम जाना मतलब रुक जाना. So this is the first drug in the first line that we are having, that is having static property, tuberculostatic property. Last that we are having is streptomycin, and I asked you to remember streptomycin. It's one of the aminoglycoside, aminoglycoside. It's one of the protein synthesis inhibitor that is mainly targeting your 30S ribosomes. 30S ribosome पे काम करके they are going to work. They act by causing misreading of the mRNA sequence. Misreading of the mRNA sequence. Because of the misreading of the mRNA sequence, there will be abnormal protein formation, and that abnormal protein that is formed will not be compatible with the life. Because of this abnormal protein, है ना, any abnormal protein, कभी भी protein abnormal हो जाए तो life की compatibility possible नहीं है, right? So they are also going to have your cidal property. So among the first line, the only one which is having a static property is going to be ethambutol. Now if I ask you very simple question, guys, just by looking at whatever I have explained to all of you guys, which one is working exclusive intracellular, सिर्फ अंदर जाके जो काम करेगा, अंदर जाके काम करेगा, that is going to be pyrazinamide. It is exclusive intracellular. तो दूसरी बात आती है, जैसे प्यार अंदर से मारता है वैसे pyrazinamide और I usually say pyrazinamide ये अंदर से ही मारेगा, ये अंदर से मारेगा, right? This will be killing from inside, like pyar kills from inside, this will also be killing from inside. Then we are having streptomycin, that sounds like streptomycin, stripping है ना, not allowed inside, outside ना, stripping कहाँ पे, outside. It is for the exclusive extracellular bacilli. Rest of the compound they will be effective for intracellular, extracellular, दोनों जगह पे काम करेंगे. But which one is working exclusive intracellular? प्यार inside, stripping outside. प्यार से एक और बात याद आई, ध्यान रखिएगा, प्यार इज वेरी वेरी टॉक्सिक एज वेल. तो विथ रेस्पेक्ट टू हेपेटोटॉक्सिसिटी, दिस विल बी मैक्सिमल हेपेटोटॉक्सिटी. You might be asking, sir, what about isoniazid rifampicin? They are also hepatotoxic, right? I said yes, they are hepatotoxic, but प्यार सबसे ज्यादा टॉक्सिक है. आइसोनाइजिड रिफाम्पिसिन भी टॉक्सिक है, बट सबसे टॉक्सिक प्यार है. तो प्यार के बारे में सुनते रहिएगा, प्यार का डोज हाई है, प्यार अंदर से मारता है, प्यार बहुत टॉक्सिक भी है. इथम्ब्यूटॉल एंड स्ट्रेप्टोमाइसिन, दे आर नॉट मेनली टॉक्सिक टू द लिवर, दे आर टॉक्सिक टू द किडनी, है ना. नाउ प्रेगनेंसी की बात करेंगे, तो प्यार को वी ऑलवेज से दैट अवॉइड प्यार ड्यूरिंग प्रेगनेंसी. जितना अवॉइड कर सकते हैं अवॉइड करिए, बट स्ट्रिपिंग तो बिल्कुल अलाउड नहीं है. स्ट्रिप्टोमाइसिन, स्ट्रिपिंग इज एब्सोल्युटली कॉन्ट्राइंडिकेटेड इन प्रेगनेंसी. सी, नो ड्रग इज 100% सेफ. ये प्रेगनेंसी वाला कॉलम में है. No drug is 100% safe in pregnancy, but if you have to compare relatively, others are relatively safer. So प्यार को अवॉइड करना है, प्यार को अवॉइड करना इन प्रेगनेंसी, ठीक है. नाउ जीन म्यूटेशन की बात करेंगे, तो आई थिंक पहले वाले का जीन म्यूटेशन सबको पता है. तो रेजिस्टेंस इज मेनली एट्रीब्यूटेड टू सम जीन रेजिस्टेंस. सो रेजिस्टेंस इज मेनली occurring due to some gene mutation. So what is isoniazid? Isoniazid is getting resistant because of the CAT-G gene, कैटरीना जी वाला जीन. अगर ये नहीं है, रिमेंबर, तो नेक्स्ट दैट यू कैन लुक फॉर इज INHA जीन, बट नेवर लुक फॉर INHA एज द फर्स्ट पॉइंट, बिकॉज मोर देन 80 to 90% केस ऑफ द रेजिस्टेंस इज मेनली बिकॉज ऑफ द CAT-G जीन म्यूटेशन. रेजिस्टेंस that is leading to gene mutation, resistance is mainly occurring due to gene mutation. Which gene mutation? CAT-G gene mutation will be causing resistance of isoniazid. RNA polymerase inhibitor rifampicin, so you can remember RPOB gene mutation, RNA polymerase B gene, RPOB gene, very very easy. And we are having next pyrazinamide. So we remember PNCA gene, प्रियंका जी, है ना, PNCA. तो क्या करना है, प्यार किससे करना है, प्रियंका जी से करना है. PNCA gene mutation will be causing resistance of the pyrazinamide, है ना. Then ethambutol, very very easy to remember, EMB gene mutation, ethambutol. And streptomycin will be your RRS gene mutation. RRS gene mutation will be mainly because of the RRS gene mutation that we are having will be causing your streptomycin ka resistance. Now remember fluoroquinolone, they are also having inhibition of the DNA kinase. So fluoroquinolone will be having GYRA and GYRB gene mutation. Fluoroquinolone, GYRA, GYRB gene mutation. Few points about para-aminosalicylic acid. Remember, they are the first ever anti-tubercular drug, and they inhibit folic acid synthesis. They are static property. They are actually associated with hypothyroidism. तो जब भी बात आती है टीवी में, which anti-tubercular drug is associated with hypothyroidism? So two drugs that we are having, one is known as your ethionamide, Ethionamide is also associated with hypothyroidism, and para-aminosalicylic acid, it's also associated with hypothyroidism. In fact, it is one of the very recently asked question in one of the very recent examination as well. They both are associated with the hypothyroidism. Since we are talking about tuberculostatic, first line में मैंने बोला था सिर्फ एक ही ड्रग है tuberculostatic, उसका नाम है ethambutol. But second line में we are having many drug. And in 2020 AIMS also they already asked this question कि tuberculostatic drug कौन सा है. So I always ask you to remember tuberculostatic drug by the simple mnemonic. अगर मैं बोलूँ कि you have to pee, है ना, P तो बोलोगे सर स्टैटिक हो गए तो P करेंगे, P स्टैटिक हो गए. So that is going to be para-aminosalicylic acid. Then we are also having one drug that I have already told you, ethambutol, that is among the first line drug. Other compound is like your ethionamide. Next that we are having is going to be cycloserine, and other one is going to be thiacetazone. Cycloserine and thiacetazone. Thiacetazone was the correct answer when it was asked in the 2020 AIMS examination, which of the following is tuberculostatic. So PCT is a very simple mnemonic to remember all the drugs that are having tuberculostatic property. Alright, now I am having one more box for all of you guys to summarize all the important side effect, because side effect के बिना TB वाले question complete नहीं होते हैं. So I have just pre-written here just to save some time here. Isoniazid as a compound, remember they are associated mainly with the peripheral neuropathy as a side effect. Now this peripheral neuropathy is mainly attributed or mainly occurring due to two important reasons. Isoniazid as a compound, they actually promote vitamin B6 का excretion. They actually promote vitamin B6 का excretion, and they also inhibit the activation of pyridoxine to pyridoxal phosphate. They do not allow the activation of pyridoxine to pyridoxal phosphate. Because of these two reasons, always remember isoniazid is associated with peripheral neuropathy, and therefore we always add vitamin B6. Pyridoxine is a very essential part of your anti-tubercular drug regimen. Okay? They are the compound metabolized by acetylation, and therefore they will have high risk of SLE as well. And we Indians, as a very fast acetylator, so we are having high risk of slow acetylator, so we are having high risk of peripheral neuropathy as well, because wherever there is a slow metabolism, the drug will continue to stay in the body for longer time, and because the drug is there in the body for longer time, they will promote peripheral neuropathy more rapidly. Apart from peripheral neuropathy as side effect, they are also causing psychosis, xerostomia, that is dryness of mouth, and they can also decrease the seizure threshold. So in epilepsy patient, you should be very careful whenever you are going to utilize this compound. Rifampicin, all-time favorite question. Red orange. R for rifampicin, red orange urine discoloration, hepatotoxicity, and flu-like symptom. Flu-like symptom was more commonly seen when it was done intermittent dosing, but nowadays, since it's going to be daily dosing for drug sensitive or drug resistant, everything is daily dosing, flu-like symptom is much lesser. Pyrazinamide, most hepatotoxic, that I have told you already. And second thing is going to be, it's going to increase the uric acid level, and it can precipitate the gout. Now there are 5-6 important reason why I always call pyrazinamide as pyrazinamide. You might be wondering, sir क्या वजह हो सकता है, जल्दी से बता दो. Pyrazinamide के बारे में quickly revise. Pyar ka dose always should be high. So isoniazid rifampicin was given 510. Pyrazinamide is given 25. Pyar ka dose is always high. Pyar always kills from inside. Pyrazinamide always exclusive intracellular bacilli को kill करता है. Apart from that, they are going to be very toxic. Pyar बहुत toxic है. Pyar should be avoided in pregnancy. और प्यार करना किससे बता दिया मैंने, प्रियंका जी से प्यार करना. PNCA gene mutation will be causing resistance of the this pyrazinamide or pyrazinamide. And last point is प्यार दर्द भी देगा, डेफिनेटली दर्द देगा. कौन सा वाला दर्द? गाउट वाला पेन देगा ना. प्यार दर्द भी देगा, तो डू रिमेंबर दिस. pyrazinamide, it's going to precipitate gout as well. Then ethambutol, it will be causing red orange urine discoloration secondary to optic neuritis. They are causing optic neuritis, and they can also increase the uric acid level, precipitating the gout. They can also precipitate gout. Streptomycin, they are highly autotoxic nephrotoxic drug, and they are also having neuromuscular blocking property. Because of this, they are contraindicated in myasthenia gravis patient. Although we know for sure that streptomycin as a compound is not an active part of NTEP regimen, because NTEP तो oral promote करता है, and streptomycin is aminoglycoside, it's injectable. We are not using actively. They are the reserve kind of compound. ठीक है. Apart from that, hypothyroidism वाली पूरी important side effect मैं आपको बता चुका हूँ. They are associated with the ethionamide and your para-aminosalicylic acid. Now one last question, HIV plus TB का केस आता है, तो always and always remember we should never start both the drugs together, है ना, because अगर आपने HIV which is antiretroviral drug immunosuppressant you are going to give, there is high risk of iris syndrome. Iris syndrome is immune reconstitution inflammatory syndrome. So to avoid the iris syndrome, remember to avoid the iris syndrome you should always start ATT 2 weeks prior to ART. 2 हफ्ते पहले क्या स्टार्ट करोगे? पहले ATT, मैं फिर से बोल रहा हूँ, पहले ATT है ना, पहले ATT, उसके बाद से एंटी रेट्रोवायरल ड्रग, पहले TB फिर जो है HIV, पहले TB फिर HIV, है ना। TB का ट्रीटमेंट 2 हफ्ते पहले स्टार्ट करेंगे, देन एंटी रेट्रोवायरल ड्रग का हम ट्रीटमेंट स्टार्ट करेंगे। Whenever you are going to start, always and always remember rifampicin is a very potent enzyme inducer, we already know. So if you want, you can utilize one of the congener of the rifampicin, alternative to rifampicin that we have is known as your Rifapenti, Rifabuti, Rifapenti. These are the congener of the rifampicin that will be utilized as and when required. Now rifampicin as a compound is a very potent enzyme inducer. Currently we are using a regimen called TLD regimen. This is for the post exposure prophylaxis and this is also utilized for active management, है ना। active management में भी इसको यूज करते हैं। TLD मतलब tenofovir, that is one of the nucleotide reverse transcriptase inhibitor. Tenofovir is one of the nucleotide reverse transcriptase inhibitor. Lamivudine, it's one of the NRTI nucleoside reverse transcriptase inhibitor, and dolutegravir, it's one of the integrase inhibitor. टिग्रावीर इंटीग्रेज इनहिबिटर। नाउ इन सभी में अगर देखोगे तो टिनोफोवीर दे आर अनचेंज्ड मेटाबोलाइट इज एक्सक्रीटेड वाया यूरिन, है ना, अनचेंज्ड फॉर्म इज एक्सक्रीटेड वाया द यूरिन, सो दे डू नॉट रिक्वायर योर माइक्रोसोमल एंजाइम ऑफ द लिवर। लेमिवुडीन इज मेनली मेटाबोलाइज्ड बाय योर सल्फेशन. Sulfation is one of the phase 2 metabolism reaction. Again, they are not a substrate of CYP3A4. Dolutegravir as a compound which is one of the integrase inhibitor. Dolutegravir is one of the integrase inhibitor. They are substrate of microsomal enzyme CYP3A4, and in that case scenario remember the dose of dolutegravir will be doubled. So dolutegravir मान लीजिए अगर 50 मिलीग्राम दे रहे थे पहले, तो अब इसका 100 मिलीग्राम कर दोगे। 50 रात में जो चल रहा था वो चलेगा, मॉर्निंग में भी आप 50 ऐड करोगे। अनलाइक lamivudine, tenofovir, इन दोनों का डोज इज नॉट अल्टर्ड, डोज इज नॉट अल्टर्ड। However, if you are using other regimen, and you feel that they are substrate of CYP3A4, for example, if you use a compound that is having Navir, Navir is one of the protease inhibitor, or if you are going to use a compound that is a drug like your other integrase inhibitor, or let's say any other compound that is having CYP3A4 CYP3A4 का substrate, in that case scenario you are supposed to change and you use the congener of the rifampicin like Rifabutine, ठीक है। So this will be antiretroviral drug and ATT वाला 2 हफ्ते पहले ATT स्टार्ट करेंगे, बाद में एंटीरेट्रोवायरल थेरेपी, एंड अगर TLD रेजिमेंट दे रहे हैं तो डोलुटिग्राविर का डोज को हमें डबल करना पड़ेगा, ठीक है। नाउ फ्यू इंपॉर्टेंट MCQ बिफोर आई एंड दिस वन. This was the recent PYQ. 26-year-old patient with history of MTB was started on anti-tubercular drug. 6 months later the patient presented neck swelling and increased TSH level. Neck swelling, increased TSH level, they are mainly suggestive of what? Hypothyroidism. So I told you only 2 drugs associated with hypothyroidism, ethionamide and para-aminosalicylic acid. Correct answer for this one, ethionamide. साइक्लोसेरिन, रिमेंबर इसका साइड इफेक्ट होता है साइकसेरिन, एक ऐसा सेरिन जो आपको साइकेट्रिक कर दे, न्यूरोसाइकेट्रिक साइड इफेक्ट विल बी विद द साइकसेरिन. पायराजिनामाइड आई हैव ऑलरेडी टोल्ड यू, दर्द देने वाला, दैट मींस इंक्रीजिंग द यूरिक एसिड लेवल. पायराजिनामाइड मोस्ट हेपेटोटॉक्सिक. रिफाम्पिसिन रेड ऑरेंज यूरिन, रिफाम्पिसिन इज आल्सो हेपेटोटॉक्सिक एजेंट. आई हैव ऑलरेडी टोल्ड यू दोस. A patient has a history of night sweat and cough for last 2 months, was brought to the hospital. Workup revealed pleural effusion and raised adenosine deaminase. Which of the following antibiotic will be given in the initial? So this is again, they are not mentioning the drug sensitive, drug resistant, so we are always going to consider this as a case of drug sensitive tuberculosis because he is presenting for the very first time. So they are asking for the initial first 2 month क्या यूज करोगे? तो अभी तो मैंने आपको बताया कि बच्चे आप यूज करोगे HRZE for the 2 month and then you are going to use HRE for 4 month. So for the first 2 months, definitely we are going to use ethambutol, not linezolid, streptomycin and levofloxacin. Levofloxacin is linezolid, they are the drug resistant TB ka, and streptomycin is a reserved drug. Which of the following ATT act by inhibiting mycolic acid synthesis with the need of catalase peroxidase? Again, 2021-2022 NEET-PG का question. With the need of catalase peroxidase, आप खुद बता दो किस ड्रग को catalase peroxidase चाहिए था? CAT G, Katrina G, isoniazid, right? Rifampicin was RPO B gene, है ना? streptomycin RRS gene, pyrazinamide PNCA gene, Priyanka ji wala gene, right? So INH isoniazid will be the correct answer for this one. True and false, there can be multiple true or multiple false statement in this one. कई सारे true हो सकते हैं, कई सारे false हो सकते हैं. So let's read, and all of you guys, you can keep on answering this one. Which of the following is true or false about the anti-tubercular drug? Isoniazid is a mycolic acid synthase inhibitor. True or false? Isoniazid mycolic acid synthase inhibitor. Definitely it's one of the true statement. Rifampicin is only used in TB. Is it correct? No. Rifampicin के uses मैं बताता हूँ बहुत सारे हैं. And in our usual classes, I used to give you a mnemonic that they can be utilized in burn lamp वाले condition में. Burn lamp is a very simple mnemonic to remember जहाँ कहीं भी rifampicin use कर सकते हैं. Burn lamp stand for your brucellosis. We can utilize in brucellosis. We can also utilize them in leprosy as an anti-tubercular therapy. Then also in meningococcal meningitis prophylaxis, meningitis prophylaxis, and also for the prosthetic valve endocarditis. So see, multiple uses है ना रिफाम्पिसिन के. So ये सबसे शॉर्ट लेक्चर है टीबी का जो मैंने आपके सामने प्रेजेंट किया है. इसमें मोस्ट ऑफ द टॉपिक टीबी के मोस्ट ऑफ द क्वेश्चन अगर आप करते हैं तो डेफिनेटली यू विल बी एबल टू क्रैक मोस्ट ऑफ द क्वेश्चन. यहाँ से जितने की क्वेश्चन पूछे गए या पूछे जा सकते हैं आपके लिए. ठीक है, तो रिफाम्पिसिन ओनली यूज इन टीबी बच्चे, इट्स अ फॉल्स स्टेटमेंट. इट कैन नॉट बी ट्रू स्टेटमेंट. प्यारजिनामाइड इज लीस्ट हिपेटोटॉक्सिक. अभी तो मैंने बताया प्यार वेरी टॉक्सिक. सो अगेन इट्स अ फॉल्स स्टेटमेंट. बेडाक्विलिन इज एटीपी सिंथेज इनहिबिटर. कैसे याद किया आपने? बी बेडाक्विलिन, ए एटीपी सिंथेज इनहिबिटर. क्यूटी प्रोलॉन्गेशन इज अ साइड इफेक्ट. है ना, रिसेंटली आस्क्ड क्वेश्चन अगेन. बेडाक्विलिन इज एटीपी सिंथेज इनहिबिटर. दैट्स अ ट्रू. प्रीटोमेनिड, देन इसी का एक और भाई है, क्या नाम है? डेलामेनिड. सो मैं कैसे बोलता हूँ, याद करो, मेनिड एंड मेनिड दे आर अ माइकोलिक एसिड सिंथेज इनहिबिटर्स. दे आर आल्सो true statement. They are also considered as a true statement, right? So this was anti-tubercular drug along with its important MCQ that I wanted to discuss with all of you guys. Although we had very less MCQ here, but I hope you can understand that this was not an MCQ session. This was actually overall theory session which I wanted to summarize NTEP, और ये काफी समय से pending चला आ रहा था. I hope all of you guys have enjoyed this lecture here. You can download the PDF from this Telegram, t.me FMGE solution. Please don't forget to like, share and subscribe, and let your friends know that you are learning from this channel. This is a very new channel that I started for all of you guys, and you let me know what other topic you want to study. Definitely I will be more than happy to record that for you. D or Dr. Siraj Ahmad _pharma is my Insta. You can also follow me here. Here we are posting regular flashcard, regular MCQ for all of you guys. Thank you very much to all of you guys. I'll see you in my upcoming class. All the best.